Protein in urine is detected using the reagent strip method, which relies on the principle of protein error of indicators. In this test, the pH of the protein-sensitive area is maintained at 3.0. Albumin in the urine binds to the dye, shifting its spectrum so that the color appears to change from yellow to green. The test is more sensitive to albumin than to globulin. One common source of interference is highly alkaline urine, which may cause a false positive result. Proteinuria, or the presence of significant amounts of protein in urine, is the best single indicator of renal abnormality, particularly glomerular involvement. It can be associated with multiple myeloma, orthostatic proteinuria, which is a benign condition that occurs after standing and strenuous exercise. Microalbuminuria is detected using specialized sensitive tests, since the protein levels are too low for routine reagent strips to pick up. Periodic monitoring for microalbuminuria is especially beneficial for patients with diabetes, hypertension, or peripheral vascular disease. Detecting small increases in albumin early allows treatment to begin before kidney disease develops. Several commercial screening methods are available for this purpose. The reagent strip is commonly used to analyze urine for diabetes. The renal threshold for glucose reabsorption is between 160 and 180 milligrams per deciliter. The strip is specific for glucose only. Its principle is based on glucose oxidase, which uses a double sequential enzyme reaction. A positive copper reduction test with a negative strip indicates the presence of a sugar or other reducing substance that is not glucose. On the other hand, a negative copper reduction test with a positive strip can occur because the strip is more sensitive than the copper reduction method. However, oxidizing agents such as bleach or peroxide may interfere, producing false positive results. The Clinitest tablet is used to detect glucose and other reducing sugars. It is based on Benedict's copper reduction test. In this reaction, copper sulfate, sodium hydroxide, and a reducing substance produce cuprous oxide. Sugars reduce the cupric ion to the cuprous state in the presence of alkali and heat. The resulting color change ranges from blue-green to orange-red, depending on the amount of sugar present. The Clinitest is also used as a screening test for galactosemia, a rare congenital carbohydrate metabolism disorder seen in pediatric patients. The test detects sugars such as galactose, lactose, fructose, maltose, and pentose. Ascorbic acid, or vitamin C, can cause false negative results, but only when taken in very high doses. To avoid a phenomenon called pass-through, the 2-drop method is recommended instead of the 5-drop method. Pass-through occurs when the reaction moves from negative or blue to positive or orange, and then back to negative. Urine pH testing is based on 2 indicators that provide a wide spectrum of color changes. There are no false positives or negatives. Clinically, alkaline urine may indicate old urine, or be seen after meals as a response to hydrochloric acid secretion. Protein detection is based on the protein error of indicators, with the pH held at 3.5. Albumin binds to dye, shifting the spectrum. False positives may occur in highly alkaline urine, while false negatives may occur when proteins other than albumin are present. Proteinuria is considered the best single indicator of early renal disease, particularly glomerular involvement, and it may increase after strenuous exercise. Glucose testing uses the glucose oxidase method, a double sequential enzyme reaction. False positives can occur from bleach, while false negatives may be caused by ascorbic acid, ketones, or high specific gravity with low pH. Clinically, glucose in urine is associated with diabetes mellitus. Ketone detection is based on sodium nitroprusside reacting with ketones to form a purple color. False positives may be seen with highly pigmented urine or levodopa metabolites. False negatives can occur with improper storage. Ketones are clinically significant in uncontrolled diabetes, high-protein diets, and dehydration with vomiting or diarrhea. Testing for blood relies on a peroxidase-like reaction. Peroxide on the strip reacts with blood to release oxygen, which then reacts with a color indicator, producing a color change. False positives may be caused by bleach, while false negatives can result from ascorbic acid, ketones, or high specific gravity with low pH. Clinically, hematuria, hemoglobinuria, or myoglobinuria may be indicated. Bilirubin testing uses the diazo reaction, where diazonium salt reacts with bilirubin to produce a bluish-purple color. False positives may occur from medication colors, while false negatives may result from ascorbic acid or nitrite. Bilirubin in urine is associated with bile duct obstruction and liver damage such as hepatitis and cirrhosis. Urobilinogen is detected using Ehrlich's reaction, where para-dimethylamino-benzaldehyde reacts with urobilinogen to produce a peach to pink color. False positives may result from highly pigmented urine or certain medications, while false negatives can occur due to nitrite. Clinically, increased urobilinogen is associated with liver damage such as hepatitis or cirrhosis, and with hemolytic anemias. Nitrite testing is based on the diazo reaction, where nitrite reacts with amine reagents to form a diazonium compound, which then reacts to produce a pink color. False positives can result from medication color, and false negatives may occur with ascorbic acid. A pink reaction is considered significant for the presence of bacteria, often indicating urinary tract infection. Leukocyte testing is based on the action of leukocyte esterase, which splits an ester to form a pyrrole compound that reacts with a diazo reagent to produce a purple color. False positives may occur from bleach, while false negatives can result from glucose, protein, high specific gravity, or certain antibiotics. Clinically, a positive leukocyte test indicates white blood cells in urine, usually pointing to bacterial infection, or pyuria. The test primarily detects granulocytes rather than lymphocytes. Specific gravity testing relies on the pK, a change of polyelectrolytes. False positives can occur with protein and false negatives with alkaline urine. Clinically, very low values may indicate diabetes insipidus, while high values may result from radiopaque dye. The human chorionic gonadotropin, or HCG, is a glycoprotein hormone made up of alpha and beta subunits. It is secreted by the placenta. The appearance of HCG in the mother's serum and urine, along with its rapid rise in concentration, makes it an excellent marker for confirming pregnancy. Human chorionic gonadotropin can be detected as early as 7 to 10 days after ovulation, which corresponds to about 1 day after implantation. A positive result is defined as a concentration of 25 millinternational units per milliliter or greater. Levels of HCG peak around 8 to 10 weeks of pregnancy. The first morning specimen is the preferred sample for testing because it is the most concentrated, improving detection accuracy.